The sounds of the Bayside, and this is Best Medicine with me, Gaytana, and I have on the line my guest, Dr Nikki Frescos, Chair of Wounds Australia. Welcome to the program, Nikki.
Thank you, Gaytana, and thank you for the invitation.
Oh, such a pleasure. So important. Now, listeners, from the 17th to the 23rd of August, it was Wounds Awareness Week. Now, I know I'm catching up a bit late, people, but better late than never. And there were important messages that were focused on in that week. Dr. Nikki, talk to us a little bit about those important messages for people, please.
The important messages are that if you have a wound that is not healing, like a cut to the skin that hasn't healed within about 2 to 3 weeks, you must get it seen to, because it means that something else is happening. And the something else could be that because of your health, because of diabetes or poor circulation, the wound is not going to heal. And the longer the wound doesn't heal, the more chance of it becoming infected. So if it becomes chronic, as in it hasn't healed properly within 4 to 6 weeks' time, you need to seek professional health advice on how to go about and manage this wound.
Yes. And though I don't want to terrify people or panic anyone, there can be some very nasty repercussions if one leaves things too long, can't there?
Correct. So, there's the health implications. If a wound is left too long, as I said, it can lead to infection, and it might not just be infection on the the wound itself. It can start spreading.
Yes.
In particular, and I don't want to scare people, but in particular for a person with a diabetic foot ulcer, it can lead to amputation. So the earlier and the better management, the better outcome it will be.
Yes, and we've had notices from various health professionals, from the doctors at hospitals and medical clinics, saying that not so many people are presenting for regular health checks and for other conditions, and often it seems to be because they're afraid of perhaps catching the coronavirus if they go to hospital, go to the doctors, or maybe some of them are concerned that the doctors and the hospitals need to focus on COVID rather than them. But everyone's health matters, and really don't put off. Have the regular checks. If you've got the wound, be seen to. That would be a key message, wouldn't it?
Oh, very much so. And it's quite disturbing that people think that their wound is just a hole and no one, doesn't really matter and I can hide it. It is really, really important to continue with the appropriate management, the treatment.
Yes.
I know of cases that have ended up in emergency because the wound has become so infected that they've ended up in emergency, and unfortunately I know of a few cases that have had amputations. So no, please do not leave it. Doctors can still treat wounds, or you can seek assistance from specialist wound clinics or specialist nurses. And if they're afraid to access to physically go in and see a doctor or the nurse, there is telehealth. It's just a telephone call, and you can discuss what you're concerned about your wound. You can discuss, if there's any colour changes or if there's an unpleasant smell or if there's pain. All that can be discussed, and the doctor or the nurse, etc., will be able to advise you as to what to do. And they can reassure you if they really need to see you that you can come in. There are measures of checking, COVID symptoms. So it shouldn't stop people from going. We do have safe environments, I can guarantee you. But
yes.
It's important.
Yes, and of course, knowing all this, they will have COVID-safe protocols in place, so you will be safe, and don't take risks, people, with these sorts of things. And for any listeners, even if it's not directly relating to you, if you have a family member or anyone you know with a wound or chronic wound, then pass on the information, please. It's so important. Now, we know too, Nikki, don't we, that really there are quite significant impacts on people who have got long-term chronic wounds. There are impacts in a number of ways, physically, mentally, financially even. It's costly to the health budget. So what are some suggestions for improving things?
Well, where do I start?
Oh, yes, it's huge, isn't it? I know.
Um, I'll start. Oh, dear me. Financially, this is a tricky question because financially it'd be really good if we had some government support. But, it's a very costly affair to have a wound, especially one that's been going on for years. It's the cost of the dressings can be up to about $340 a week for someone.
Oh, my goodness.
In the health industry, it costs around $3 billion every year to be looking after, the government's funding, $3 billion.
Yeah.
The impact on people is that they can't, once they have a wound, if it's got bandages, etc., they can't go to work. They can't do their daily activities. It costs, to see the doctor. It costs to see the district nursing or nurses. It costs them in sick days. I don't have the answer would be, financial support from the government to make products, the wound dressings, etc. Under a Medicare scheme. That would be the perfect, ideal thing to assist us with. But there's also the other impact of, it affects people's physical, life, their mobility, their restrictions to daily living. They're socially isolated because they're embarrassed because they've got their legs in bandages and some of them are oozing and there's an odour to it.
Yeah.
Emotionally, add all of that together, anxiety about when is my wound going to heal?
Yeah.
Are people judging me? The stress. And there's even times that, there are people with depression who, it's suicidal ideations. It's quite devastating. And I think it's not out there. People aren't aware of how devastating and costly a wound that's been there for quite a few weeks, years can be. And also with diabetic foot ulcers, that's another story altogether.
Yes. And with that,
I haven't given you a solution though, have I?
No, but that's good. We need to know this. And with the diabetic foot ulcers, a lot of the measures I imagine are checkups, preventive measures. What can people do to try to prevent the occurrence of the diabetic foot ulcers and maybe in general ulcers if possible or wounds? And certainly, as you've said, as soon as you get one, don't let it linger on for a long time. Is it easier to get wounds to heal if they've only been going for a shorter time rather than been going for a long time without attention?
Correct. It is much easier. The quicker a wound is healed, the better the outcome, the better the skin condition will be as well.
Yeah.
The skin condition, it won't be as traumatized, it won't be as scarred. So the longer a wound has been there, the tissue changes in its strength and elasticity. So it becomes tighter but also quite thin. So if you hit yourself, let's say, knocked your foot or leg, it will break up. It will break easier. You'll get a skin break easier and an injury occurs. But if it's more supple, then of course it'll be a quicker way of healing because the skin and the underlying little capillaries, blood supply, etc., will be able to heal it quicker. But in a long-standing wound with an old scar tissue, some of those the blood vessels, the nerves have been damaged.
Yeah.
And the damage remains, which they can't fight as well as what they would have done, prior to the wound. And the other thing about diabetic foot ulcers, 1 in 4 people who have diabetes will end up with a foot wound. And unfortunately, up to about 70% of people who have had a diabetic foot wound will end up with an amputation and die within 5 years.
Wow.
And I know it's frightening. And the analogy is being put up similar to cancer, that having a diabetic foot ulcer amputation is equivalent to some of our common cancers in terms of survival rates. So there's this big push at the moment to think of diabetic foot ulcers as when they're healed, they're in remission. So we shouldn't ignore it. We should still be caring about our feet. It's not, yep, we're done, it's okay. We need to care and manage and look after our feet. And there are, a podiatrist or a nurse can do annual checks to check your feet. There are pamphlets and instructions on how someone can look after their feet, checking their feet every day, checking the shoes that there's nothing in there that could cause like a nail, because once you've had diabetes for a long time, you lose that sensation, the nerve sensation of pressure.
Mm-hmm.
So you don't know that you've walked on a nail or a glass, a piece of glass, until you take your shoe off and you see blood in the shoe. So there are many things. I strongly suggest, if someone does have diabetes, to be checked by a podiatrist on a regular basis.
Yes.
Yeah.
That's the usual advice, I think, for many, many years, and it's very wise. And it's another reason, again, why even if you're not diabetic, any early wound that's not healing, as you said, within the first week to 2 weeks, get it seen to. It's far better to do that, because from all you've said, Nikki, about the impacts on the actual tissue, the nerves, etc., the capillaries, all of those things, when it goes on for such a very long time, how they can be impaired and damaged to some extent, which of course makes it difficult for things to heal, and then it affects the skin condition and response later on. So it's again this message of get it seen to early, like so many things. And with the diabetic people, regular foot checks and advice on what to do, not only checking your own feet every day, but the things that one can do to avoid having nasty impacts that would cause an ulcer on the foot or on around the sort of ankle and calf area, and avoid bumping and falling and things. All of those things can have an impact, can't they?
They sure can. The other thing with wounds, whether it's diabetes or a leg wound, is if it's not healing, it means that something else is happening in the body. So no matter what treatment, what special antiseptic cream is that you put on, if you don't know why it's not healing, it's not going to heal. So you need to know whether it's the arteries that's not supplying the blood there to assist with the healing. You need to know, is it the veins that aren't working properly? And once you know why the wound isn't healing, then you can address both problems, and the wound will heal.
Yeah.
For example, if it's what we call a venous wound, because of the veins aren't working, we know that we can put compression on, which will help get rid of the fluid, the edema, the swelling that happens, and then the blood supply can actually do its job and heal the wound. So it's really important to work out, why isn't the wound healing? What's the underlying health problem that it's not healing?
Can it also be some sort of low level of infection being maintained sometimes?
Well, this is a bit controversial, because many doctors think that because the wound is not healing, it's infected and it's a little bit red. It's not because it's infected,
it's
and
inflamed.
We don't need antibiotics. It's just inflamed. That's a normal healing process. So we don't need the antibiotics. We need to look at what we're doing.
Yeah.
What are we dressing it with? How are we managing it?
And with the inflammation, can it be something like with other inflammatory conditions that are sometimes spurred on or maintained by the immune system? Can it be something like that operating in these areas?
Yes, it can. Yeah. So this is why it's complicated. You need to know what the underlying problem is. Yeah. Even medication can cause inflammation. People's normal medication. So you need to assess that and determine, can we reduce that particular medication while we've got this wound? We have a saying, it's not just the whole, it's the whole person that you should be looking into.
Yes. And really, this goes to another one of my pet subjects. Get a proper diagnosis, people. And with a lot of things you'll need the interdisciplinary team, but also please don't self-diagnose. Don't go to Dr. Google. Do not do it. Please don't.
No. Don't go onto the internet and find your wound.
No, exactly. And sometimes if you go looking for these things, you find horrible things and it makes people terrified. So don't do it, people. Get the proper specialist to look at you, either your GP or a specialist. Get the right information. Dr. Nikki, I would love to talk again with you. On the last minute or so of the program, I would love to talk again. This is such an important area and issue for people, and really those ulcers and the wounds are quite common, aren't they?
Very. 1% of the population will have a leg wound. That's
Gosh.
the statistic.
It's amazing.
I know.
It's amazing. Well, go and get help, people. Dr. Nikki Frescos, thank you so much for your time. And, of course, it's Wounds Australia. They can go to your website for some information there too, I presume.
Correct. There's quite a few resources. There's even resources for doctors and nurses, etc. It's for everyone. So Wounds Australia website is the place to go. Yeah.
Brilliant. Thank you so much for your time today. I'd love to talk again another time, Dr. Nikki. Thank you. Bye-bye.
Thank you, Gaytana. Bye.
Bye.